Many independent practice owners operate under a comfortable assumption. They invest in a sophisticated electronic health record system, expecting it to act as a silent partner, humming autonomously in the background, automating the daily administrative workload, and making life easier. But any clinic running Practice Fusion knows that while the platform excels at clinical accessibility, keeping it functional requires a massive, relentless volume of human data entry. Patient chart updates, workflow management, and documentation compliance don't happen automatically. Somebody in your office is doing that work, manually, every single day. This creates a dangerous financial blind spot. Most managers look at their payroll, see the base salary of an in-house administrator, and assume that number represents their total cost for managing the EHR. This waterfall chart breaks down what that position actually costs. We start with a typical base salary around $35,000. But then we have to stack the hidden expenses: $8,500 for benefits and insurance, $2,700 in payroll taxes, and thousands more for onboarding, constant turnover, and management overhead. The fully loaded cost of a single US-based healthcare admin hire hits $60,800 a year. That is the operational reality for thousands of practices right now. Independent practices are bleeding their profit margins to feed and maintain the very software that was purchased to save them time and money. The financial drain is severe, but the operational crisis hits the clinical team directly. When administrative seats sit empty due to high turnover, those EHR tasks don't disappear. They pile up on the physician's desk, and workflows stall completely. Data from the American Medical Association quantifies the damage. Primary care physicians are now spending an average of 36.2 minutes interacting with the EHR for every single patient visit. This clock visualization shows the scale of the imbalance. For every 15 minutes of face-to-face interaction a physician gets with a patient, they average 9 minutes of charting in the EHR. The downstream effects are devastating. Over 43% of U.S. physicians report symptoms of burnout, costing the healthcare system $5.6 billion annually. On the clinic floor, this translates to delayed billing, denied claims, and a crippled revenue cycle. Relying on the traditional in-house staffing model creates a structural bottleneck that prevents doctors from being doctors while suffocating the practice's cash flow. High-performing practices are stopping this bleeding by separating their clinical care from their clerical processing. Instead of relying on generalist in-house staff, these practices are outsourcing their Practice Fusion workflows. They use dedicated, remote virtual medical assistants, or VMAs, whose sole professional focus is EHR administration. While local hiring requires a 6 to 8 week onboarding and training cycle, a specialized VMA arrives already HIPAA certified, already trained in Practice Fusion, and ready to execute your protocols within 48 to 72 hours. By reallocating this labor to dedicated remote specialists, practice managers turn a chronic, unpredictable staffing crisis into a solved, highly reliable operational utility. Transitioning to a remote VMA model is a structured process designed to avoid disrupting your current patient flow or daily revenue cycle. This timeline maps the integration. It begins with a 60-minute discovery session, producing a custom workflow blueprint. Then deployment begins. We establish secure EHR credentials and initiate a 10-day ramp-up. Your VMA scales from 50 to 100. It auto-categorizes incoming Practice Fusion tasks by urgency and runs real-time HIPAA compliance monitoring on all processing, all without slowing down the human workflow. Marrying highly trained human experts with smart AI oversight creates an administrative pipeline that absorbs your practice's volume. You scale your capabilities without adding a single person to your local headcount. Let's return to the forensic audit and put these two operational models side by side to look at the final bottom line numbers. On this chart, an in-house hire sits on the left. On the right, a Staffingly VMA costs $21,600 per year, 0 hidden fees. The result is a hard savings of $39,200 per position, a 64% reduction. And quality improves along with the margins. Clients report 99% plus task accuracy, which eliminates the documentation backlogs and compliance threats that routinely cause denied claims. Remote EHR administration provides independent practices with the data-backed foundation required for long-term operational survival. The medical staffing shortage is a permanent fixture. Practice leaders must immediately stop absorbing the hidden tax of in-house EHR administration and make a structural change. You can initiate a free, customized Practice Fusion analysis right now by visiting staffingly.com/demo. There is zero operational risk to explore this. You can begin a 2-week risk-free pilot with no long-term contracts, and your VMA can be live in just 48 to 72 hours. By delegating the administrative burden to remote experts, independent practices can finally clear the bottlenecks, stabilize their revenue, and return their focus to where it belongs: actual patient care.